In a facelift procedure, I'm going to remove not only redundant skin in the lower face and the mid face, I'll also reposition the underlying tissue, but by recreating and lifting the underlying tissues, then I'm really going to create foundation and improve contour and projection of the mid face specifically. If a patient has a lot of skin, then I may need to use a longer incision, but for patients who have less skin, I can use lesser procedures or lesser incisions. So a short scar facelift may just involve an incision in front of the ear and behind the ear. The more skin that a patient has, the more release of the skin that I may need to do, and therefore I may need longer incisions. So the incision in front of the ear may extend into the hairline in the front, and then also may extend along the back of the hairline if the patient has a lot of redundant skin in the neck. Neck lift surgeries can also be done through a small incision in the chin, where I really just release the tissue of the neck and tighten the skin muscles. And so a surgery like that can take anywhere from 4 to 6 hours, really depending on how much skin I'm trying to remove and if I need to do any other procedures in conjunction with it. Patients will typically spend a night in the facility or with a caregiver, and then it takes about a week for the incisions to initially heal. We'll remove any sutures that need to come out at that time. And then usually I just tell patients to refrain from any heavy lifting or strenuous activity or exercising for up to 6 weeks. In some patients who have a tremendous amount of extra skin, then we have to be creative on how we place those incisions. I really plan my facelift incisions so that if I have to remove extra skin, there's going to be a small horizontal incision right at the level of the sideburn. And that prevents me from elevating the sideburn or creating something that looks unnatural. And that can be a telltale sign of a facelift. So for facelift procedures, there are potential for visible scars. The goal of the surgery is to place tension at specific key points so that the rest of the incision lines up very nicely and heals really so it's almost imperceptible. But that's always the risk of a facelift procedure, is that there are potential visible scars.